that family app. So for me, having obviously a family member who's in and out of hospital quite frequently, quite a lot over the last year, if I'd have had something like that, say trying to ring up and annoy the ward staff and ringing up to check how he is, if I'd have been able to see that his observations have been done, maybe that idea of the note thing saying, you know, that little voice recording or that note that could be interpreted, so I could see a note from them on the app saying, you know, it says, you know, Peter says he's okay, could you bring this, don't worry, just a little note that would really reassure him to go, okay, so he's fine, I know he's alright, he's being his cheeky self, he's asked for that note, and that'd be really reassuring. I wouldn't be having to ring up. I think that's really great. Sometimes it just doesn't stop. Sometimes the patients can be on the phone for a while, or equally if you're the family member trying to ring up, I know I've spent hours on the phone by the time I've got through and asked how they are. I've sometimes spent a good hour of my time.
I can understand patients, family members want to call up and see how their family members are doing, but at the same time that could be a phone call where someone else from a different department's trying to admit a different patient onto the ward and they can't get through because the lines are logged up with family.
That idea, the notes on the family app is a really good idea. Like if you can log on and say, you know, John's had his blood pressure done, John's had his temperature done, notes say that, you know, he's okay, you visit him later, he's had his tea, nothing, he's telling you, you know, John said don't worry about anything. You could see those notes and communicate with your family member that way. You wouldn't need to ring up at all, would you?
No.
Or equally, you could put the note on saying, when you get a chance, can you please call the ward? And then they're only calling if the staff ask them to because they need them to.
Absolutely.
Yeah.
Like a 5-second phone call to say, you know, look, you know, if they ring up, is that really okay? Because you've asked for that, you know, you've asked them to ring up, so you've set aside the time for that phone call because you clearly need to take it for a certain reason. So it's, you know, that 20 minutes you're on the phone is because you've asked them to ring up, not because they've rang up and you can't get them off the phone.
Yeah.
You know, they've rang for a reason and that's fine.
I feel a lot of the conflicts between family, public and nurses and stuff too is they'll ring up, they'll ask to know how their uncle's doing. Whoever's answered the phone will go, oh, I'll get the nurse who's looking after him. They'll go to the nurse go, I'm busy, I'm trying to do a cannula, I'm trying to do this.
Or I've had it before where I've been off for a week, I've gone in, and then I had it the other shift, I had 2 patients' families ring up, and they're like, well, can you tell me how such and such is? It's all actually, I had to be truthful, say, look, I've not, this is my, you know, I haven't been on the ward in a week, I've not had a chance to meet your family member yet. And unfortunately, there's no one about who's done enough shifts with your family member to give a decent enough handover.
As for the phone calls though, when you say, look, the nurse in charge will give you a call back after when she's dealt with the other patients and you forget, and they ring up again, go, oh, well, I was meant to have a phone call, but if we had that voice note and the voice recognition and the app.
Yeah, or I think it saves, we've had patients in the past who they've got family members and the sister might not get in with the mom and don't live with them, or they might not like the person's partner. So not only do you have the partner ring up, the mom might ring up and the sister might ring up because they all don't communicate. Whereas if they can all just download the app, you can put the notes on, there's no ringing up from 3 different family members. They've got the app to see how Joe Bloggs is, they know he's alright. Especially where I work, if we could just literally put their own, I mean, we do have some patients who the family members ring up because they're not great with technology or their parents are older, and that's fine, that's understandable, but for patients whose families would be able to access and use the technology, the less phone calls, because that 5 minutes on the phone could be spent starting the med round, that's 5 minutes you're late to the med round or finishing it. Some nurses are very quick to go, he's fine, there's been no changes, end of. Some will give a detailed of how it's very hit and miss as well. Very simple, clear cut, if family's okay, please don't worry.
So it's always going to be.
Up to date, isn't it? Yeah.